Now let's discuss the gallbladder primary channel. First, we trace its pathway. The gallbladder primary channel begins at gallbladder 1 at the outer canthus of the eye. This point is reached by a small branch which separates from the triple burner primary channel at triple burner 23 on the frontozygomatic suture, but according to some authors, at triple burner 22, which is a handful great circuit or the Yang axis of Shaoyang. From GB1, the external pathway runs to GB2 in front of the ear. Then it ascends to the forehead and stomach 8. Then it traverses to the temporal region in a slight curve, passing to GB4 to GB7 and continues to triple burner 22, anterior to the root of the ear. Then it passes through triple burner 20, superior to the apex of the ear, and curves posterior to the ear from GB8 to GB12. It then traverses the lateral aspect of the head to GB13 and GB14 on the forehead. Again, it traverses to the side of the head to GB20, then crosses the superior aspect of the shoulder and passes GB21 and triple burner 15 to reach GB14, where it meets the other young primary channels. It then continues to SI12, but according to some authors, previously passing bladder 11 and stomach 12 in the supraclavicular fossa. One branch runs from GB20 to triple burner 17, enters the ear and travels to SI19, passes stomach 7 and continues to GB1 at the lateral canthus of the eye, descends to stomach 5, again ascends to the infraorbital region where it meets the triple burner primary channel, then descends to stomach 6 on the lower jaw, traverses the lateral aspect of the neck, passing stomach 9 at the sternocleidomastoid and meets the main branch again at stomach 12 in the supraclavicular fossa, where the latter divides into two branches. The first branch is the inner branch, which enters the thorax, meets the pericardium primary channel at pericardium 1, runs across the diaphragm, connects with the liver and the gallbladder, traverses the hypochondrium and continues to the lower abdomen, enters the lumbar region near the femoral artery, according to Solinas and others, via stomach 30 and continues along the pubic hairline of the hip. The second branch, the outer branch, descends superficially from the supraclavicular fossa, crosses the mid-axillary line and continues along the lateral thoracic wall, passing liver 13 at the free end of the 11th rib and continuing to the hip to GB29. It then traverses the sacral region, passing bladder 31 to bladder 32 to bladder 33 and bladder 34 over the sacral foramina and continues to DU1. From here, it travels laterally to GB30, where it reconnects with the main branch. The external pathway descends along the lateral aspect of the thigh to the knee and further along the anterior posterior border of the fibula, passing the anterior aspect of the lateral malleolus and ending at the ulnar corner of the nail of the fourth toe. A further branch originates at GB41 on the dorsum of the foot and travels between the first and second metatarsal bones to the tip of the big toe and liver 1, where it joins the liver channel. For its clinical importance, in exterior signs and symptoms, this will manifest with alternating fevers and chills, headaches, eye pain, pain in the cheek and on the chin, subaxillary swellings, deafness, lateral knee and leg pain. In interior or Zhang-Fu organ signs and symptoms, this will manifest with pain in the lateral costal region, vomiting, bitter taste in the mouth, thoracic pain. Now let's discuss the connections of the gallbladder primary channel with the other channels. First, its connection with the liver primary channel. This is the connection of the foot yin-yang pair of the third great circuit. Its location is between GB41 and liver 1 on the foot. Its circulation follows the circadian cycle, which is according to the organ clock. Importance, this is the exterior-interior relationship between the gallbladder and the liver. Next connection is the triple burner primary channel. This is the connection of the hand-foot pairing of the third great circuit or the Shaoyang on the yang axis. Its location is on triple burner 23 or 22, according to some authors, to gallbladder 1 on the head. It follows the circulation of the circadian cycle, which is according to the organ clock. Its importance, this relationship shows the above and below relationship. For other connections with other Zhangfu organ systems, it is connected with the liver and the gallbladder organ. For an overview of the gallbladder points and its functions, first, it affects the lateral side of the leg, the hypochondrium, the shoulders, neck, and head. Gallbladder points are important points, both local and distal, to treat headaches. They enter the brain, they affect the sinews. There are several important points on the eye system, and several points open the mind's orifices, and they are closely related to the yang lymphatic vessel and the girdle vessel. As a recap, the gallbladder channel starts at the outer canthus of the eye. It ascends to the forehead and curves downwards to the region behind the ear at gallbladder 20. From here, it runs down the neck to the supraclavicular fossa. A branch from the region behind the ear enters the ear. Another branch from the outer canthus meets the triple burner channel in the infraorbital region. It then descends to the neck and the supraclavicular fossa, where it meets the main branch. From here, it descends to the chest, and passing through the diaphragm, it enters the liver and gallbladder. It then runs down to the hypochondrial region and the lateral side of the abdomen to reach the point of gallbladder 30. The main portion of the channel from the supraclavicular fossa goes to the axilla and the lateral side of the chest to the ribs and hip, where it meets the previous branch. It then descends along the lateral aspect of the thigh and leg to end at the lateral side of the fourth toe. From GB41, a branch goes to liver 1.